My name is Shirley Lamb, and I'm the coordinator of public health. Welcome to the student panel. I would like to welcome our student panelists as they introduce themselves, and then we will begin with the questions. We can start with Joey and go down the line.
Hi, my name is Joey. I'm from the UC Davis Master of Public Health program. I actually came to UC Davis as undergrad. I got my degree in biological science, and I'm here today.
Hi, my name is Nadia Rojas. I recently graduated from UC Davis Master of Public Health program, and I did my undergraduate at UC Berkeley, where I double majored in integrative biology and ethnic studies.
Hi, my name is Rahaf Baker. I'm a current M.P.H student at UC Davis. I did my undergraduate in biological sciences at UC Irvine, and I'm expecting to graduate in June.
Hello, my name is Dario Maciel. I'm a M.P.H student at UC Berkeley School of Public Health. We have a 2-year program, so I'm in the second year of my program, and my concentration is health and social behavior.
Hello, my name is Sonny. Wow. Okay. Hello, my name is Sonny Vernard. I did my undergraduate in Temple University in Philadelphia. I'm from Long Island, New York. I double majored in accounting and economics, and I'm currently at UC Berkeley School of Public Health. I'm also a student at the School of Public Policy, so I'm in my 3rd year of my program.
Thank you. This question is for Rahaf. How did you prepare yourself for M.P.H program as an undergraduate?
As an undergraduate, I was working at the Shifa student-run free clinic, which I started my sophomore year of college. I did a health needs assessment, and I realized that I had a passion for public health. And after that, I did some more research. I presented my research at the Society of Student-Run Free Clinics, and that was more of the research side of public health, in addition to doing the health education programs at the free clinic. And then that was one way I was preparing for my M.P.H.
Sunny, would you like to answer this question too?
Okay, for me personally, since I was accounting and economics, we don't really learn about public health in that avenue, in those 2 majors. So I did a summer internship program at the University of Michigan School of Public Health, which introduced me to what public health is, because I didn't even know what it was. I was just looking for a job one summer, and I applied and learned about public health that way. But after completing the program, one of my professors in economics, he taught in health economics class. So I decided to take that class, and then after taking that class, I was a TA for the class. So I thought that was real good for me, because I got to learn more and more about like how health plays like in our economy. So that's what I did, like on the undergraduate level, find a professor who's working in health and continue to work with him.
Thank you. This question, any of you guys can answer it. How do you wish you knew about the process while you were an undergraduate student?
Which process?
I guess like how to get into the M.P.H program or school.
Me, I personally learned it throughout my summer. That summer at the University of Michigan, they really were stressing what you need to do, the letters of recommendation, the SOFIS process, because if you're applying to schools of public health, you have to apply to this thing, a company called SOFIS. Most schools of public health, that's the way that they handle applications. You have to go through SOFIS. So that was how I knew how to apply that summer. And they're also very nice. If anyone here is a junior, you should definitely look up that program. It's outstanding. They also prepare you for the GREs and things of that nature. So that's how I got informed about the application process.
I would say
Go ahead.
for those preparing, know what kind of systems the schools you're applying to use. Not all of my schools use SOFAs, so I had to write different essays or do different descriptions or CVs and prepare different documents. Another thing is research your schools as early as you can. The process for researching your schools takes a long time, and figure out what your interests are before you pick your schools. So if you're interested in epidemiology or tropical medicines or tropical diseases or biostatistics, whatever it is, figure out what direction you want to go into. You can change later, but it will help you narrow down your list and figure out which schools would be the best place to have that kind of concentration.
Just to go along with that, and also kind of identify if you don't have an area that you want to study, because there actually are a lot of programs that are kind of made for that type of student where it's a generalist track, which Davis's program is like that. So know which schools kind of offer you that option too.
Thank you. This question is for Nadia. How did you know you wanted to pursue an M.P.H degree?
So for me, I actually went into Berkeley, like many biology majors, as a pre-med, and I even graduated thinking that I wanted to go into medical school. But I think as I started, volunteering at clinics and being more in the field, I realized that I wanted to make change at a bigger level than just because a patient will come to you, and then as a doctor, you cure that patient, but it's only that patient. What I want to do is I realize that maybe there are things, it's just, what if there's 10 patients coming in for the same disease? You just want to treat them all. You want to see what's causing that. Maybe there's something in the water. Maybe, there's salmonella somewhere, food poisoning. And that's realizing that I wanted to make that change at the bigger level is how I decided to do public health. And then I started doing research into schools, into what some of the professors were doing, and I really liked what they were doing here at Davis. At Davis, they have a strong research into migrant farm workers, and some of the professors here are working with improving the health of migrant farm workers, and I really saw my passion with that, and so that's how I decided to come to Davis's program.
Thank you. This question is for Dario. How is your experience as an M.P.H student different from your experience as an undergraduate?
Well, one of the biggest things that I think is different between my undergrad and the UC Berkeley School of Public Health is how hands-on it is. So for example, in our classes, I took a program planning class where we learn how to design, develop, and implement public health programs. And what I liked about that class was that it wasn't just about writing a paper about program planning, and it wasn't about writing, a proposal for an imaginary project. What they did in that class was that they brought in a lot of different community organizations to pitch their projects to our class and ask us for their help in developing those programs. So the project that I was on was developing a mobile clinic for certain populations in Oakland, California. And it was mainly for day laborers and sex workers who weren't accessing traditional clinics because of stigma or because of income and other or documentation status and other issues like that. And so what we did is we actually did the research for the program. We developed a proposal, we budgeted it out, we presented it to the organization that had pitched it to us, and then they took that onto themselves and actually put the program into place. So it was really great to see that the work that we had done throughout that class was actually going to get implemented. And that was a big difference from undergrad, where I feel like things are a little bit more at the surface level. You're kind of getting your feet wet in the material. Whereas in public health, when you're doing an M.P.H, you're actually doing work in the week 1 that you're going to see its impact out in the community in week 2. So you don't have to wait 4 years or 2 years to actually see the work that you're doing bear fruit, and you don't have to actually wait before you can jump in and start doing the work. So that's what I would say is the biggest difference, is that an M.P.H is very practice-based. So a lot of the learning that you'll do won't be learning in the classroom. You'll actually be learning how to do it outside of the classroom.
Thank you. This question is for Joey. What are some key skills that students should possess to excel in pursuit of an M.P.H?
Sure. Some good skills probably be time management is a good one for any student, undergrad or graduate, but especially when you kind of, in the last session we kind of touched on what a typical day of an M.P.H student is, and it can be pretty varied. So a lot of our programs involve something called a practicum, which is basically a big project that you design, or you contact a different agency and you kind of take that project on, and it's your hands-on in the real world experience. So I mean, it's a lot of time management with dealing with your project, dealing with classes, making sure you're studying for classes, because one of the biggest differences, at least for me, I wasn't used to this, in undergrad and grad school. In graduate school, you are required to get a B or better in every class, or else you have to take that class again. Not to say I didn't do well in undergrad, but that's just a little bit of extra pressure. But so time management, and then just kind of passion. I think sometimes the wear and tear of the daily going to class, you're going to your internship, and if you're like me, you're working. Sometimes that can really wear on you, but as long as you have the passion for public health, I think that's really important.
Sunny, would you like to add on to this question?
Sure. I definitely agree. I just definitely echo those sentiments. Time management is a big issue. Is a big thing that you should be real well at, because like I feel like I definitely feel at Berkeley, like there's so many classes that you want to take, and that becomes like a problem because you're interested in so much and you only have like typically 2 years to get everything done. So I know me, like the first year I had 5 required courses, but I was also taking a course in food justice with Michael Pollan, which wasn't even on my thing, but I was going there like every Tuesday. It's like, man, you got other responsibilities, but you know, you find yourself like so interested in other things. And me, I started out as a pure public health student, but then I applied to the public policy school as well. It's because there's so much that you want to do, but you only have 2 years, and plus Sally Mae is going to be wanting her money soon, so you got to graduate at some point to pay off those loans because she does not play. So I think that's the major thing, definitely the time management thing. That's huge.
Can I add something?
Yeah.
I would also add that this, at least for me, this wasn't a skill I had in undergrad, but just the skill to kind of identify when you're struggling in classes and to actually take the initiative to go talk to your professors early on, especially in grad school where the class size is a lot smaller, and this is a big investment in you, and you're investing in the school as well. Like, make sure you actually talk to your professors and kind of let them know they'll be more understanding than you think, especially if you go to them early on. So I think that's a really good skill to have.
I would also maybe add 2 other things. So one thing, as people said, time management and knowing when you're struggling, but also along with that, self-care is a really important skill, and it really is a skill. So you have to know when you've reached your limit, when you need to take a break. If you're somebody who likes to exercise and school is interfering with you being able to do that, knowing how to carve out the time to do that. If what you like to do is like watch Breaking Bad and that's how you de-stress, you also need to be able to do that and recognize it isn't just about school. So you are there to learn and you are there to get a great education, but you also have to take care of yourself. The other skill that I think is important, not just in public health, but everywhere, is critical thinking. So learning to question everything. You're going to hear from your professors who are experts in their field and who have been doing this for 20 years. It's okay to say you disagree, and it's okay to question whatever they tell you because they'll like that. That's how they think, and it's really important to start developing those kinds of things now. So think about the things that you hear from the people that are teaching you and question that. So critiquing and having critical thinking skills is also going to be really important.
Thank you. This question is for Rahaf. Do you have any advice for students who do not get into an M.P.H school or program?
I would say try again if it's your true passion. Work on, so if your GREs are a problem, take a course or self-study. I know I kind of studied for the GRE in 3 days because I didn't have enough time to, plan it out. And that worked out fine. I used my own Princeton Review book, and that worked out for me. But for some people, they struggle with their GPAs. Work on improving your GRE instead, because your GPA would be like, it's too late to fix it. Get some really good experiences. So your experiences, work on your personal statement. I know in the earlier session, one of the panelists said they spent 2 months on their personal statement. I spent 3 months. And really know why you're going into it. You need to communicate to admissions that this is your passion and you're not in it, because you want to get into medical school afterwards, or it doesn't mean anything to you. So you really want to show your potential as a student at their school.
Yeah, I'd like to add to that. I think coming from coming from a science major at Berkeley, which is super cutthroat, competitive, everything you hear about it. I don't know if any of you are from Berkeley, but you come, everyone there has that sentiment that I have to get into graduate school after I'm done. Like, that's it. There's nothing, the world will end if I don't get in the year after. And it's really hard. It was hard for me to come out of that, that frame of thinking. But I don't know, just with graduate schools, they actually really like it that you go into the real world and work. So if you don't get in the first time, you add a year to your work experience, your application gets so much stronger. And, realizing that it's so valuable to get that experience in between undergrad and graduate school, and really knowing what you want to do. Because maybe, like for me, had I gone to medical school right after I graduated from Berkeley, it wouldn't have been what I wanted to do anymore. And those 2 years that I took off really allowed me to think and to reevaluate what I wanted to do with my life, and to realize that I wanted to go into public health. So if you asked me my senior year what I wanted to do, I would have totally given you a completely different answer. I never saw myself here, but I'm so glad, that I took that time to think and reevaluate and realize that this is where I wanted to be.
Thank you. This question is for Dario and Sunny. What services do graduate recruitment and diversity services student ambassadors provide?
Okay, the grads ambassadors, they're very helpful because they are spread around the different concentrations that we have. Like, for instance, I'm in the health policy and management program, and if you're interested in, say nutrition, we try to connect you with someone like in the nutrition concentration, so then they can give you more insight on the program. Like, what's the course load like? What are some professors that you think, are real great to contact? Like, what's some classes that I should take going forward, and things of that nature. So the graduate ambassadors really give you that student experience, and we encourage people, definitely who are thinking to apply, to reach out to us, and we'll definitely make that connection happen if there's a particular area and a student. On our website, we have a list of students within the variety of concentrations, and if anyone speaks to you, we can definitely, if by reading someone's bio, anyone is of interest to you, we can definitely connect you to that individual. I don't know if you want to add anything.
Sure, yeah. We also, at the UC Berkeley School of Public Health, so we have the grads program that also has drop-in hours. So while we're in the office, you can drop by, ask us any questions you have, whether it's related to the admissions process, whether it's related to getting more insight into the programs, or just if you want to stop and chat and talk about grad school and help us help you with whatever questions you may have. So we're open to that, and we really think that putting a human face is really important in the admissions. I know that when I was applying, it made a big difference to me that Berkeley took the time to actually have students give me a call, go through my questions. I can talk to them about my statement of purpose and get feedback on, the strategies that they use to get into grad school. And then once I was admitted, it was also helpful to have the same students come back and then you congratulate me. Other schools, they sent a form letter that was like, "Dear graduate student, congratulations." But that was not the case with schools that had a more robust approach to their outreach. It was more like somebody on the phone saying, "Hey Dario, we just heard you got in, congratulations. What questions do you have? What other schools are you considering? Oh, those are also great schools. This is what you might like about them. This is what's great about Berkeley." So being able to put a human face to the outreach part of schools is what we're all about as well. And that's a really important service that I wish more students knew about, because it's really helpful if you're struggling with an application, it's really helpful. But even if you're sure that your application is amazing, it's still helpful for you to know what that school is like once you get admitted. Because it's hard to apply, but it's also hard to choose between schools, and that's a service that we like to offer to help you make the right choice, and not just to push you to enroll at Berkeley.
Mm-hmm. And just one last thing, and during the springs things change a little bit, because that's when admission decisions are going out. So then people, after getting accepted into schools, they're like, how am I going to finance school? So then we help people answer some of those questions, because one of the unique things at Berkeley is that they let you take advantage of graduate student instructor positions, graduate student researcher positions, which will help cover your tuition, and you also get paid as well, which was very helpful. So we also provide information like that as well.
Thank you. This question is for Rahaf. How did the M.P.H change your perspective of how you view a career on medicine?
The M.P.H definitely addresses the social, behavioral, environmental aspect of all the factors that go into shaping an individual health behavior of a patient. So when in medicine, you usually try and treat one person. In public health, you're working at the community level to influence those health behaviors where they first start. So if someone has diabetes, they didn't just get it. Well, you could get diabetes, if you're born with it. But some behaviors shape your health outcomes, and it's important to have a prevention side and to have that view of what got this patient here. In the earlier session, we were saying maybe there was a traffic sign that wasn't working, or maybe there's something in the water, and it's really important to see that as a physician instead of just looking at each individual on his or her own.
Joey, would you like to answer this question as well?
Sure. Back in the day, I actually was pre-med, and then I was doing all this work, and I was getting ready to apply to med school, and was getting ready for the MCATs, and I kind of just did a bit of self-reflecting and realized that my entire life, I'd been doing all this volunteerism, and kind of my entire goal, up until this point, was just helping people. And it wasn't necessarily I love science, I love research, don't get me wrong, but I love being able to kind of affect the entire community. So when I kind of put the puzzle pieces together, it was one of those duh moments, of course I should be doing public health, this is exactly what I love. So just to kind of, and down the road I do want to become a physician's assistant, but I'm passionate about public health, and I'm really excited about the opportunity of kind of becoming a PA, but using my Master of Public Health in my day-to-day life through policy, and just kind of making sure, because when you're a physician's assistant, you're kind of helping that one person at a time approach, but you can only do so much, just you're putting little drops in a huge, vast ocean. So if you kind of go a step above that, you actually can afford a lot of change. And I think my favorite saying about public health is that if public health professionals are doing their job, people don't know they're doing it.
Thank you. This question is for Dario. Do you see a potential increase in competitiveness for the applications of public health schools?
Do I see a potential increase in competitiveness?
Yes.
Well, I think the graduate school is in general competitive, and I can only see that increasing. But I think the good news is that it's also a very self-selecting process. So the people that tend to apply to the School of Public Health are people that are really passionate about the School of Public Health. So that self-selection means that if you're interested in applying to public health, you're already really competitive for public health. So you don't have to worry about, being the best applicant in terms of GPA or in terms of GRE scores. Part of being a competitive applicant is also just having the passion for public health and having a really deep conviction of what it is that you want to do. And I know that sounds very fuzzy and kind of wishy-washy, but it's the truth. A lot of what being competitive means to admissions committees is that you're able to tell your story in a way that's really compelling. And that one of the things that I do is whenever I write an essay for admission, I make sure that when I'm finished with it, I know that nobody else in the entire world could have written that same essay, and that every admissions committee member that reads it knows that that was written by Dario, and it's very clear that it's my own perspective and that I'm a unique applicant. So things are getting competitive, and I think one of the biggest pieces of advice I would give is to make yourself stand out by not bragging about all your accomplishments or having a laundry list of all the things you do, but honestly it's just by being you, because admissions committees aren't looking for any one particular thing. They're going to want a very diverse group of students, and that diversity is going to come from a lot of different places. So it's going to come from your background as well as your academic interests. It's going to come from whether you were in an urban area or a rural area. So all of these things add diversity, and you want to just show the admissions committee that you're a unique applicant. But again, like I mentioned, if you're passionate about public health and if you know that public health is what you want to do, then you're already really competitive for being admitted to a degree in public health.
Thank you. This question is open to the rest of the panel. Are you planning to pursue additional degrees after M.P.H? How will the M.P.H help you with this plan?
Well, I already said I'm planning on down the road pursuing a career in physician's assistant, but I definitely plan on using my public health knowledge in everyday life.
Well, I actually did part of the M.P.H program has a practicum experience, and for me, my practicum was at an organization called Latino Coalition for a Healthy California in Sacramento. And with them, I was working on the Affordable Care Act, and I developed a presentation on how it would affect the Latino community this year. And I was also very involved. Like, I was going to meetings at the Capitol, and I realized how important policy is, and it clicked for me. Like, I fell in love with it. And so I want to go into more policy work, and so I've decided I'm going to pursue a doctorate of public health. And for many programs, they actually require 2 years work experience post-masters. So that's what I'm going to be doing. Like, I'm going to find a job, get experience, and then apply to the DRPH programs.
As for me, I'm applying to medical schools right now, so I do plan to use my M.P.H with my M.D. Working in underserved communities, and I know that my M.P.H will help me in being a better leader on the local, national, and global levels. I do work with different organizations, so I do advocacy on the state level, and I've done local community work in free clinics, and I've worked with the Clinton Global Initiative University, and I've seen how the M.P.H can serve you really well at each of these levels, and they're all things I'm interested in. So combining my medical training with my public health training will help me better address the health needs of communities, individuals, and societies as a whole.
And one of the great things about public health is that it'll also open up a lot of different ways that you'll see how so many other types of work are related to public health. So it probably won't be, you'll find that it's really common for people to go into public health, even those that think that they're only going to do public health, to then think to do another degree. So for example, as part of my M.P.H career, I was also working part-time while I was a student at a community-based organization in Oakland that works with newly arrived immigrants and provides wraparound health, social, and legal services. And a lot of the clients that come to that center are undocumented. And it was surprised me to see that how much of undocumented immigrants' health problems related to their documentation status. So the fact that they didn't have a visa, they weren't citizens, and things like that. And a lot of the issues that they brought up were actually legal issues. So a lot of day laborers would come and say, I'm undocumented and I haven't gotten paid for about 16 hours of work and there's nothing I can do about it. Can you help with that? And so that led me to start thinking, I have this degree in public health, and that's sort of like the heart of what I want to do. But I've also lately been thinking about, I need something that can be like the teeth and the claws to actually be able to affect that change. So through my experiences in public health, I've actually now also been thinking of pursuing a degree in law, because then I feel like you have both of those aspects. You have the content knowledge that comes from public health, but then you also have a degree that empowers you to do something about the problems that you see. So public health is really important, that it does let you see that there's so many different avenues that can deal with public health. I would have never thought that you could be a lawyer that was interested in health, or that you could pursue something like a research that's focused on you can be like a basic science research that's focused on issues of public health. So there are a lot of other different degrees that can complement an M.P.H really well. And M.P.H, even just in doing the curriculum for the M.P.H, you'll see those avenues opening up, and you'll see kind of where your interests fit into it.
No more degrees for me. I'm already working on a master's in public health and also a master's in public policy. I came in as a pure public health student, and I realized as going through the program the importance of how policy policy plays a huge factor on the health of individuals. So that's what led me to apply to the School of Public Policy as well. But after going through like 3 years of school, the next step would be a PhD, and I don't want to write any more papers, to be quite honest. I'm kind of done with that.
Thank you. This question is for Sunny. How do you maintain a balanced lifestyle outside of being a M.P.H student?
The way that I keep my life balanced is I rely heavily on Google Calendar and all that, because I've got like a ton of things like going on, and I'm not like the most super organized person. So like my technology definitely helps me realize like where I need to go and what I need to do throughout the week. But then like during the weekends, I do meet up with a number of like my classmates, and we go out, we have fun, because you like, it's like what Dario alluded to earlier, you need to have like that work-life balance. You're gonna work hard, but you also need to, you know, have fun and relax too, because that, you know, is the public health thing. Your mental health is real important. Definitely, you know, like for us, like personally, like a number of, in both the public health and policy school, we have like a Facebook page with a ton of like events going on. So what people do is like post things inside what they're doing at that particular time. And if anyone wants to join, we kind of like link up that way. So I try to make it a habit to definitely meet up with my friends outside of the school setting.
Thank you. This question is open to the floor. What advice would you like to give to future students to prepare for the public health school?
We've already given a lot of advice. We're trying to think of what else we can.
I would definitely say like leverage like your social networks. I think that was a great thing for me. I know like out of undergrad, like I wanted to jump right into like graduate school because everyone was doing it. It looked so cool, and I really wanted to go. But that didn't happen for me. I actually like went out to work, but then like I kind of like my friends went out to public health school, so that was really big. And they because like. Every school that you go to, everyone's gonna be super nice and great, like, you know what I mean? Like have food for you, juice and all this other stuff. And then you don't wanna come into school and then like all that stuff like disappears, you know? So it's very important to reach out to your friends and get their experiences. Like what are the ups and downs of this program versus that, you know? Because it's a more objective information with a friend telling you. I'm pretty sure if you look at Facebook or LinkedIn and all that, you'll find out like which schools your friends have gone to. And like you should definitely use them as a resource when trying to figure out like what you're going to do, because you are making a 2-year investment. And the last thing you want to do is like, oh man, I just started school here, I really don't like it already. You're stuck for 2 years, you know? So I definitely say take advantage of that as much as possible. Reach out to your friends to find out about, you know, the programs.
Yeah, and also, I mean, I think maybe this was one big thing I was looking at when I was looking at the different public health programs in schools, is just some schools, they're very more traditional in their master's approach, where you kind of take your classes and then you write a big master's thesis. Whereas other programs, and it sounds like the Berkeley and Davis are both like this, instead of taking that approach, it's a little bit more about doing a big project, the practicum. And so for me, that was really important, is that I knew for me that I did not want to go to a school where it was mostly based on a thesis. I really wanted to go to a school where there was a practicum and I would actually be having that real world experience. So just kind of like start looking at the different schools, see the things that they're talking about, see that if they're talking about tracks, if they're talking about practicums, and you'll kind of start to identify like, oh, that's not something I want to do. And then you can kind of look at the different programs and see which ones have that aspect and which ones don't. And you can kind of learn a lot about maybe what you want and what you don't want.
Thank you. Does anyone in the audience have any questions for the student panelists? Okay. Oh.
Sure. Do you guys want to go first, or?
Sure. So I'm at Berkeley School of Public Health, and my concentration is health and social behavior. The thing that I love the most about health and social behavior is, you know, thinking back to when I graduated from undergrad, or even when I entered public health, I wouldn't necessarily have considered myself like a social justice person, but at Berkeley, social justice, especially at the School of Public Health, social justice is a theme that runs through all the concentrations. And I like that it has that focus because it makes you, again, it makes you think critically about things, and it makes you see public health as broader than just, interventions. It makes you think about how to best put those interventions forward so that you do advance social justice issues and so that you do take into account, it's not just you coming into a community and saying, hey, I know you guys have this problem, here's how I'm gonna solve it for you. So in Berkeley, we really focus on going into the community and learning from them and saying, what are the strengths of your community? What can we learn from you that will then we can take that and help you solve your own problems? So it's much less paternalistic than a traditional public health approach. And that's the thing that I love the most about health and social behavior. If I had to say, and I know this is being recorded, so so I have to go on record as to what I don't like about it. But I'll be honest with you. I guess the thing that I like least about it is that that I think that in a lot of schools of public health, especially those with a strong social justice focus, there isn't as much of what's lacking for me. I think in general across schools of public health is trying new things and being okay with failing. So when somebody proposes a potential public health solution, not having it always to be like, did you do a lit review? Did you see like evidence in the literature that this is going to work? Because I feel like I'm not so interested in like evidence-based practice. I'm more interested in like practice-based evidence. How can we try new things that'll then generate the evidence to say, hey, we tried this new, we took a risk, it didn't work, so maybe not do that. But then we have this other program, we tried it and it worked really well, so now we have a new avenue that we can explore. And I feel like that's something that's missing, I think, just in public health in general, is that is letting people know that it's okay to try new kind of quirky or weird things and seeing if they're going to work. And the worst that can happen is it doesn't work out and it doesn't get the outcome that you wanted, but at least you learn from that. So I would say that's probably the thing that I enjoy the least is that I wish there was more of a drive towards innovation, and innovation is really going to work better through experiencing some failures. So.
I know me personally, what I really like about this school, Berkeley School of Public Health, is definitely the faculty. Like, they really do have like an open door policy. I know, like, I was taking a health impact assessments class, and there was a professor who was an expert like in our project, but she was out like on sabbatical. And our professor, the professor for this class said, reach out to her anyway. And we shot her an email, and she took an hour out of her schedule. She's like, sure, come by, we'll have some food, we'll talk, we'll relax. And like, she really took the time. She wasn't getting paid for it. And that really like spoke volumes to me, because I know I have spoken to people at other schools where some professors are kind of like rock stars and celebrities, and you can only access them through like their GSIs and GSRs. And sorry to throw out acronyms, graduate student instructors. So you don't really get access to the professor, you just get access to the TA. So that really spoke volumes to me. How much the professors like really want to help you. And I know when I was applying for policy as well, like professors like walked me through the process, and that was definitely helpful for me. The thing I don't like, a negative would be, I know this kind of sounds corny, there's not enough time to do everything that you want to do, because you'll be so interested. You'll come in thinking that you know that you're interested in like one thing, and then you'll take one class in something else and like, oh, I'm interested in city planning. Or you might take a class at the law school and like, oh, I'm really interested in how health and law relates in this way. So you kind of feel like you feel like you want to take everything, but you don't have time to kind of like do all that. So I wish the classes were recorded, probably, like, so I can, get as much. But that's the major thing. You don't have time to do everything that you want to do. So that's the negative.
I guess I can start for the UC Davis M.P.H program. So one of the things I really, really, really liked about my program was that we had so many people from so many different backgrounds. We have veterinarians in the programs. One of my friends who was in the program last year, she's in veterinary school right now. Doctors, PAs, pre-nurse, everything you can think of. Someone who went to the military, And that, it was just, all our conversations were so amazing. You see, I don't know, like I'm used to seeing things in a certain way, and then hearing it from like a veterinarian perspective, you see things in a different light. And so that collaboration, and the UC Davis M.P.H, we share a building with the veterinary school. And so we also had professors from the veterinary school, and I really love the like One Health approach of the UC Davis, of how everything's related. It's not just, it's not just human health, it's also the ecosystem, the animals, everything. And so I really, really love that about our program, how many different minds and experiences were there. And it made my experience, so much greater there. And something I didn't like, I think I'm gonna have to echo what was said earlier about not having enough time to take everything, especially since our program is a 56-unit program. It's a little bit more than a regular academic school year, but I would have liked to take so many classes. We have the opportunity in the program. We have a medical school, a nursing school, a law school to take classes, in various departments and elsewhere within graduate programs here at the university. So we have that it's an amazing opportunity here, but I didn't have as much time to take all these classes that I wanted to, and I really regret not having that time.
So I would definitely echo what Nadia said about the fact that there's people from so many different backgrounds, and that not only just the backgrounds, but also from so many different age strata. So, we had people who had been well established into their careers coming back for this, and then people who were straight out of undergrad. And so, everyone had so much to bring to the table, and it just really made the experience that much richer. And I think another great thing about the Davis program is actually it's a geographic location, is that Davis is right next to Sacramento, which is where the California Department of Public Health is. And so it makes it really a lot easier for some of us who are doing our practicums. CDPH is right there, so we can go. So I think a good majority of us actually ended up doing our practicums at the California Department of Public Health. So that was an amazing opportunity to learn a lot about public health at the state level. So that was really cool.
I really love, to echo what you said about collaboration. I have nursing, so I'm taking a class at the medical school with nursing students and other types of graduate students. And yes, the downside is we don't have enough time. So for that class, I do have to miss like 3 of my other core classes to go to that one class. But it does make it worth it because the class is excellent. There's so much collaboration, so many resources. The faculty will meet you halfway. They will try their best to make it work for you. So my professors are okay with missing some classes. They worked around their schedule. Other faculty, I'm planning a conference. So I asked one of the professors for help, and she sat on the phone with me for a whole hour telling me how I can make the conference better. And it's a student conference. She has, she's not coming to it or anything. So they do take out a lot of time of their own free time to make sure that you're succeeding and that you're reaching your professional goals.
I guess a drawback, because I've definitely got to focus on the positive and the negative, is we are not a school of public health. We are a program. And we are relatively young compared to other schools of public health. So, for some people, that can be a drawback.
Mm-hmm. The flip side, too, is because we're so young, there's so many opportunities, too. So it's all in your approach. So it's a young program. You can create new organizations. You can create new projects. The administration is so open to changes. Students have a GSA rep who speaks for them. And if there's something that can be changed to make it better, they're very receptive to it.
Thank you. As we come to an end of our student panels, I would like to thank our student panelists again for sharing their experiences. Hopefully this panel was beneficial to everyone, and thank you for coming.